Hi everybody, my name is Chris Lieu and I'm a GI medical oncologist at the University of Colorado Cancer Center. It's been an extraordinary and challenging time for the state of Colorado, our country, and the world. And despite the difficult times we're facing, it's been really encouraging for all of us in the healthcare industry to see the teamwork and the collaboration and the help we've received from our fellow staff, our patients, our families, and our friends. And thank you to all of you for all that you're doing to prevent the spread of COVID-19. And just remember that every step that you take towards prevention has the power to save lives. And I think we've seen that from so many of you. And please know that it's appreciated greatly. For our patients with cancer, or for people who have loved ones that are diagnosed with cancer, there are some things that you can do that you've all heard many times, but can really save lives and prevent infection. One of them, as you all know, is to wash your hands often, and this is with soap or water for at least 20 seconds. And a lot of times, we don't wash our hands for 20 seconds, and so there are several tricks that people talk about to wash your hands for that long. Some people say go through your ABCs. Some people say sing happy birthday to yourself 2 times in a row. But it is a little bit longer than we would typically kind of think about washing our hands. But definitely do this, especially after blowing your nose or coughing or sneezing or being in a public place. To the extent possible, avoid touching high-touch surfaces in public places, and this means elevator buttons, door handles, and handrails, and obviously shaking hands with other people. And if you have to touch something, you can either use a tissue or use your sleeve to cover your hands or your fingers. People talk about avoiding touching your face, nose, and eyes, and this is something that a lot of people do, including myself, do very often. But also clean and disinfect your home to remove germs, and this includes frequently touched surfaces, again, like tables, doorknobs, light switches, and also to avoid crowds, especially in poorly ventilated spaces, as your risk of exposure to any respiratory illness increases in a crowded area. And this is what they mean by social distancing, a term that's used now every single day. Specifically for patients who have been diagnosed with cancer, if you're currently receiving therapy, a lot of times your doctors are still going to recommend continuing the treatment as planned unless notified by your care team. And so one of the most important things is really just have a conversation with your doctor about the benefits and the risks of continuing treatment, of maybe delaying treatment or reducing treatment or increasing the frequency of time between treatments. If you've been diagnosed previously with cancer and you're currently in surveillance, so you currently have no evidence of disease, at this time we would consider postponing visits really until the summer, as long as the benefits outweigh the risks of postponing that visit. And we would also strongly encourage people to consider virtual health visits, as virtual health visits are a great way to connect with your care team, but also doing it in the safety of your own home. The CDC guidelines recommend using a mask if you're sick. At this time, they're not recommending mask use in general, kind of everyday activities, but that also may change in time, so certainly keep up with the news. And just remember that even if you're diagnosed with cancer, it doesn't automatically mean that you're severely immunocompromised. And so many healthcare institutions are postponing elective or non-critical procedures like CTs or MRIs. But keep in mind that you may, just because you've had a prior diagnosis of cancer, and even if you've received chemotherapy in the past, it doesn't necessarily mean that you're severely immunocompromised right now. But also kind of remind people that we really live in a very fortunate time in a day where we can actually get groceries delivered to our house and have food delivery. If you think about where we were even just 5 or 10 years ago, these were things that just weren't possible. And in fact, the way we're able to communicate with each other, whether it's through virtual telehealth medicine visits or even connecting with friends and families through FaceTime, Zoom, or Skype, we live in a connected age where if you think that even if this virus had hit roughly 10 years ago, our lives at that time would be very different than they are right now. And I just want to really remember that every action that you take towards prevention really does contribute to flattening the curve, allowing our hospitals and healthcare institutions to take care of patients that really do need the healthcare that is required sometimes with the COVID-19 infection. And just remember that it's not a matter of if we're going to overcome this virus, because we will. And it's just a matter of how we do it, and almost most importantly, how we treat each other in the process of doing this. And really, we really want to see the best of people really come out during times of crisis, and I think that that's what we're seeing right now. And so seriously, all of you who are listening, thank you for taking the time to listen. Please know that we are going to overcome this virus, that everybody in the healthcare industry really appreciates all that you're doing, and that we will be here to support those that are sick. And so please stay safe, stay healthy, have conversations with your doctors when needed, and please take great care of yourselves. And thank you very much for taking the time to listen. Bye-bye.